regarding the children, especially I will start from the pregnancy. So when the pregnancy period, we used to encourage the pregnant women to have a walk around. Now, the exposure to pollutants leads to in vitro or in utero growth retardation. So there is a growth retardation. The chances of getting preterm birth, chances of getting multiple pregnancy-related complications, preeclampsia, pregnancy-related hypertension, these are all, the percentage are significantly much more in cases of in utero complications. Now going to the postpartum or when the child is grown up, it leads to the growth decline. It leads to growth decline as well as the intrauterine, sorry, it leads to growth retardation. It leads to cognitive dysfunction. It leads to more aggressive behavior of the child, attention seeking hyperkinetic disorders. These are the ADHD, which you used to call. Now, these are all. Second, the most important thing is that the infective ability or the immune system of the child is hampered. So the chances of getting multiple infections from a childhood age are much more. So it leads on a long-term basis to asthma. Second, the another most important thing is that long-term exposure of the pollutants to the child also leads to a significant amount of hematological abnormality. It leads to increase in the RBC or it leads to polycythemia, which we all know. But the most important is the psychological consequences. If we cannot keep in the COVID, we are seeing that the children are almost confined to home for almost 1.5 years. So we cannot keep them at home for such a prolonged period of time. We all know they will develop multiple psychological as well as psychiatric complications. They are all nowadays taking help of the parents. Are most of the parents nowadays are also they are not unlike 10 or 20 years back. They all are working women. So we need to make them. So if we cannot make our environment children friendly, so the long term future, what will happen after 20 years, the situation will be more grave, no?